sleepiness. So we'll be exploring the topic from those two perspectives. I'd like to just first of all give our viewers a bit of an overview about narcolepsy. You may have heard the term. Sometimes in movies or on TV shows, narcolepsy may be depicted usually in a humorous way. And the person in that sense has extremely severe sleepiness, and they're often made fun of, or they're maybe falling asleep in unusual situations. But in truth, narcolepsy is a rather common sleep disorder. It affects about 1 in 2,000 individuals. That's not rare, actually. That's a similar incidence to multiple sclerosis. And narcolepsy is a spectrum. There are some individuals with very severe sleepiness, but there are many more with moderate sleepiness or less mild or more mild forms of the sleepiness. So not everyone is falling asleep while standing up, or things that are depicted in the movies. And we know that narcolepsy is a neurologically based sleep disorder that involves a biochemical deficiency in one particular region of the brain known as the hypothalamus. And narcolepsy is a situation that is not curable, but it is treatable. It is treated through a combination of lifestyle changes and medication. And so it is very much in the patient's interest to be diagnosed and then treated. So, Liz, you had touched on kind of going back to early life. So your symptoms of sleepiness began perhaps in university years?
That's my first recollection, but it has been steadily getting worse. And I'm glad you touched upon the topic of how narcolepsy is generally viewed, because I had always thought that it was the all or nothing, the falling asleep when you were talking to somebody.
Right.
And so my symptoms didn't present as what I consider to be the typical case of narcolepsy.
In fact, you had one of the auxiliary symptoms of narcolepsy with some regularity. It's known as sleep paralysis.
Right.
Tell us about that, what that was like.
For years, I suffered a very stressful phenomenon that I now recognize as sleep paralysis, but I never told anybody about it because I didn't want to be labeled strange.
It's a bit an unusual symptom. Yes.
But the perception is that you're just beginning to wake up. It would always happen in the morning. The perception is that your eyes are awake, wide open. I'm not sure whether they were or not, but you are paralyzed in bed. I mean, it's like somebody is actually holding you down, and you're trying to send signals to body parts to move, and they won't move, and you can't speak. And
it sounds terrifying.
It is very terrifying, and if panic sets in, then it just becomes exponentially worse. After I started yoga, I found a way of moving myself into a calm space, which allowed me to fall back asleep.
I see.
And that was the only way out of that.
Well, and you can tell from the nature of that symptom how a patient might be reluctant to just bring that up.
Absolutely.
For discussion.
Yeah.
It's not a common experience, and many of my narcolepsy patients have said that is at least as troublesome to them, as stressful as the sleepiness.
Oh, absolutely.
And
absolutely.
Can be terrifying. Some individuals with sleep paralysis will comment that the episode is broken if there is a sudden stimulus, like the phone rings or if someone touches them. And we don't fully understand why that is, but it is a common feature. There are some other symptoms of narcolepsy, and I don't know that you have all of these, and I think that's a good point to mention, that not every narcolepsy patient has all of the symptoms. So another fairly common accompaniment of the sleepiness is known as hypnagogic hallucinations. And these also tend to occur as the individual is waking up from sleep, and it represents the intrusion of dream-related images, seeing or hearing things that have a dreamlike quality into wakefulness. So again, a bit of a bizarre, type of symptom. I don't recall that you've had much of that.
Not much of that. Once or twice, I felt like there may be somebody in the room, and I couldn't scream for help. But that was not as common as the general paralysis.
Right. A third symptom which many narcolepsy patients have is known as cataplexy, and this is occurring during the day when the person is up and around. This is a very sudden onset of weakness, loss of muscle tone, and many individuals will say that it feels like they're a puppet and the strings have been cut. The person literally loses tone and could even fall to the ground if they are not able to take a seat quickly. One of the unusual features of cataplexy is that it's often brought on by a sudden emotion. Laughter, surprise, anger, fright, elation, any type of sudden emotion results in loss of tone. And obviously that can be very disabling for some individuals. Not all patients with narcolepsy have cataplexy either. Liz, moving ahead to the diagnosis and then getting started with treatment, how was that process for you? Was it a difficult time?
No, I'll have to say that diagnosis and treatment has been a life-changing experience for me. I just wish that it had happened sooner. I find myself now at the age of 60 wanting to live life at 150 miles an hour because just to catch up. But I've always been motivated, but now I'm totally focused, energized, and super motivated. And frankly, I think, the sky is the limit. I just, I'm not looking back. I'm just going forward and just trying to do, just trying to be the person I knew I always could be now.
That is very well stated.
Right.
That's wonderful. Well, and of course, in your case, we've employed a combination of a few lifestyle changes and then medication to boost the level of alertness. And so in your experience, then the medication has been a very positive
no doubt about it, yes.
Wonderful. The challenge with narcolepsy, I think, is to help individuals, first of all, come for help and realizing that, as we said earlier, it is a spectrum, and not everyone with narcolepsy has the severe end of the problem.
Right.